Hello everyone. Welcome to the bag valve mask portion of your pre-course package for your Recert. My name is Stéphanie Romano and I'm one of the regional paramedic educators. What I'm going to show you here is a PowerPoint presentation with the tips and tricks and indications and contraindications for use of the BVM. We'll also show you a video at the end where we have one of our local medical directors and another regional paramedic educator show you the actual skill of applying the BVM appropriately and correctly, and then maybe alleviating some of the issues that might arise. And so upon completion of this training module, you should be able to identify the indications and correct application of the BVM in a cardiac arrest patient. And you should be able to summarize the techniques to improve bag valve mask ventilation in patients that are difficult to ventilate. So while the BVM is a required piece of equipment in every ambulance, it's the most popular device for providing ventilations to patients, but it does have some challenges. It does require significant training for proper use. It requires a very tight seal, either with one hand or two if required. The seal is easily lost during transport and CPR, and so additional modes of ventilation might be required, for example, a King LT or intubation. It can also cause significant gastric distension if the proper seal is not maintained. It can also force blood and vomitus and also fluids actually into the airway. So the BVM must have a one-way valve that does not jam with vomitus or mucus and will not pop off. If there's any failures noted or within the BVM, it should be discarded as it may cause overpressure of the lungs or inadequate concentrations of oxygen being delivered. So the pop-off valve actually limits the amount of pressure being delivered to the lungs. Unfortunately, if the patient requires a higher pressure to be delivered to the lungs, then the patient does not receive the full volume of gas within the bag. This type of situation might be encountered with COPD or asthma patients, for example. The bag must also have a reservoir to allow for higher concentrations of oxygen to be delivered. The amount of oxygen being delivered is dependent upon the patient's ventilatory rate, the volume being delivered in each breath, and the rate of oxygen flowing to the bag and the reservoir. And again, the filling time for the reservoir as well. So all BVM devices should be attached to supplemental oxygen, as we all know. And when attached properly, can provide up to 90% oxygen concentration to that patient. The mask should be soft and a good seal on the patient's face. Should also be transparent so that you can see any type of vomitus that happens to come up if it does come up. So always select the mask that provides the tightest seal and conforms best to the patient's mouth and nose. So indications for the use of the bag valve mask include absent or inadequate spontaneous respirations, a need to pre-oxygenate when intubating or potentially inserting a King LT. You might also use it for short-term oxygenation when ventilation is temporarily compromised. So contraindications for the use of the BVM include inexperience in the operator. So for example, you wouldn't hand over a BVM to a bystander on scene who had never seen one before. There's definitely some skill associated with the BVM, and so experience is definitely required. Active or passive regurgitation. So again, we don't want to force that regurgitation, that vomitus or mucus, back into the patient's lungs. If the patient has a tracheoesophageal fistula, if there are facial fractures or trauma, if there are disruptions in the facial dermal surfaces, or if there's oral bleeding or vomiting. And so the required equipment when using BVM is, of course, that face mask that is clear and well-fitting to the patient's facial structure. You do need the actual bag, additional oxygen supply at a minimum of 15 liters per minute, and of course suction should you require it. And so assessing for difficulties in ventilation can be quite difficult in patients when you're bagging them. For example, facial hair might prevent a proper seal, and so in this case you might need a two-handed seal. So you might need an extra rescuer if you do have that on scene to help bag the patient. Facial trauma, including open cheek lacerations, fractures of the mandible, or large open facial wounds, would make bagging again difficult. Facial burns would make it quite difficult. Distension of the abdomen or large chest wall. So if you see distension of the abdomen, you might not be fully ventilating the lungs of the patient, so that air might be going into the stomach instead, which could potentially again cause vomiting in that patient. You could have severe bronchospasm with limited chest exertion. And airway obstruction. So again, if you feel resistance when squeezing the bag, you might be not again filling the lungs. Obese patients or patients with bull necks might be quite difficult to have a proper seal, or again to force air down into the lungs instead of into the stomach, and then neck instability as well. And so lastly, I'd like to introduce Dr. Adam Dukelow, Local Medical Director, and Tracy Gaunt, another regional paramedic educator. And they're going to demonstrate the actual skill of ventilating a patient with a bag valve mask. And they're going to show you the one-handed version versus the two-handed version, and also give you some tips and tricks on how to make that a better skill to use while in the field.
Welcome to the Southwest Ontario Regional-Based Hospital demonstration of bag valve mask ventilation. By now you've reviewed the webinar portion, which goes over in lecture format exactly how to do this. Myself, Adam Dukelow, one of the local medical directors at Regional-Based Hospital, and
Tracy Gaunt, one of the regional paramedic educators,
will now demonstrate the actual procedural skill of BVM. So Tracy will start by properly sizing up the oropharyngeal airway.
And from your selection of airways, you want to look and see which one's the most appropriate, and to measure properly, you want to go from the corner of the mouth to the bottom of the ear, and this one is the most appropriate size for this patient.
So now she's going to show you how to properly insert the oropharyngeal airway. So you see with her left hand she's lifting up on the jaw, and with her right hand she inserts a quote-unquote upside down OPA and then turns it in order to lift the tongue off the posterior pharynx and allow adequate entry of air. Next, Tracy's going to size up the actual mask and make sure that it provides adequate coverage over the patient's mouth and goes up to the bridge of their nose. Tracy's now moving into demonstrating how to properly apply the mask to the patient's face. Note that she has 3 hands on the patient's jaw and is actually pulling the patient's face into the mask as opposed to pressing the mask into the face. We note that sometimes more junior providers or trainees, such as medical students, will be pushing the mask onto the face of the patient to try and get a better seal, when in fact you should be pulling the face into the mask. Once she has an adequate seal, she's now going to apply the actual bag apparatus to the mask. You may have done this all at the same time, but we wanted to make sure we laid out each of the steps in the skill. Once she has the adequate seal, the bag's applied, she is now bagging the patient using about half of the volume of the bag in order to not overventilate or create barotrauma, and she's bagging at a rate of about 10 to 12 breaths per minute. We also note that some amateur or more junior providers will bag too quickly. They get excited about a really sick patient and start bagging at 30 or 40 breaths per minute as opposed to the appropriate 10 or 12 breaths per minute. There is one other thing we want to demonstrate during this video. Tracy's now going to switch to a two-hand technique. This is something you can use in the patient that you're having difficulty getting a seal with. So you ask a second provider to actually do the bagging portion, and you perform the mask portion of BVM. So Tracy now has 2 hands essentially in the same position, and she has more strength with 6 fingers to pull the patient's face into the mask than she did with 3, and I will continue to bag with half of the volume of the bag at about 10 to 12 breaths per minute. Thank you for your attention to the video, and if you have any questions, please feel free to send them through our website or ask us during the Recert Day this year.